So I think 0.5 centimeters might be doing this.
Hi, welcome back. I hope you had a good Easter. You had a wonderful weekend. I'm glad the sun is back out. A little bit windy. So, if you're ready, let me get started. I believe you have a test on next Monday. It's going to cover the 2 lectures that I gave before the break, which described the concept of utility, the concept of effort and reward, the idea that you can describe vigor of movements, which is sort of the speed by which you move, as a way that maximizes the utility. And we talked about muscles, the idea of motor units, proprioception, Golgi tendon organs, descending pathways, the parietal cortex, and today we're going to continue our discussion of the parietal cortex, and we're going to talk a little bit about the motor cortex as well. I'm going to describe for you an interesting observation in the parietal cortex, which has to do with a symptom called neglect, which happens in human beings. So the posterior parietal cortex, PPC, as we described on Friday, you have neurons that have visual responses. So if there's a stimulus that you would like to move toward, that stimulus on your retina gets represented in the parietal cortex as a location, where that location has a relationship with respect to the fovea. Now, the fact that these are not visual cells, but they are action cells, meaning that in the parietal cortex, there's this location you want to move to, and that stimulus, you may not even be able to see it, but you can still make a movement toward it. So what one wonders is that do these cells in the parietal cortex have this property of maintaining their discharge even when the stimulus is gone? So here's an example. So the cue comes on, and then the animal has to wait until they get a go cue to make a movement, and you see that the cell keeps on firing. Now in this case, the cue goes on and then it goes off, so the animal can no longer see the stimulus, but they still got to wait for the go cue to go on before they make a movement, and you see that the cell keeps on discharging. So your ability to make movements toward things that you no longer see comes about because you have cells in your parietal cortex that remember the location of the stimulus, and they keep on firing even though that stimulus is gone. So this stimulus is relevant to the animal because if the animal makes a movement toward it, it's going to get reward for it. And it's that reward that makes it so that the movement is about to be performed and you see the activity that sustains. So the difference between this cell in the parietal cortex and a cell in the visual cortex would be the visual cortex would only respond if the cue is on the retina, so the activity would go away here. But in the parietal cortex, you see this because we're representing actions now. We want to perform a movement, and we will perform the movement despite the fact that the stimulus is gone. Any questions about this? Okay. So one of the properties of our visual system is that the stimulus to the left of the fovea gets represented in the right hemisphere. The stimulus to the right of the fovea gets represented in the left hemisphere. So in this experiment, I want to show you how you can see this in terms of an fMRI type of a signal. How the planning of the movement gets transformed from one hemisphere to the other depending on where the eyes are looking. So here's the way the experiment works. So the instruction appears on the screen that says S. S means saccade. You're going to make a saccadic movement. So the target appears here, and then it goes away. There's these distractors there, and then you make a saccade there, and then you come back. So in this case, the movement is made so that a stimulus appeared to the left of the fovea. You were looking here, and then the stimulus appeared here, which means that the activity should be on the right parietal cortex, which is indeed the case. Now, what one can do is to move the fixation point. So say that you have to do a pointing task. So the pointing task begins with an X on the screen. You look at this X here. Then you see a target here to the left. Now, in order for you to make a movement, you're going to have to wait. This target moves to one step further, so it was here, now it moves to here. Now you make an eye movement to here, to this point here, and now after you're done, you make a reaching movement to the goal. Now what's interesting is that when you moved your eyes from here to here, the reaching movement now is to a target to the right of fixation, whereas before the stimulus was to the left of fixation. So by simply moving your eyes, you should change the representation of the goal. When the target was to the left of fixation, you should see activity in the right parietal cortex. When you move your eyes from here to here, like you do from here to here, then now the goal is over here, which means that the activity should shift to the contralateral side. So by simply moving your eyes, the representation of where the goal is should shift from one hemisphere to the other. When the goal is to the left of fovea, the activity is in the right parietal cortex. But when you move your eyes from here to here, the goal is the same, it's here. But now its representation must change to the other hemisphere. Does that make sense? Okay. No? Let me go over it one more time. So representation of action in the parietal cortex is with respect to where you're looking. If you are looking here and your goal is here, then that's to the left of where you're looking, activities in the right parietal cortex. If you move your eyes from here to here, now the goal is to the right of fixation, which means the activity should be in the left parietal cortex. And so there will be a shift from one side to the other. And indeed, if one does fMRI type of analysis on the human brain, as you move your eyes from one location to the other, but the goal location remains the same, activity shifts from one hemisphere to the other. Yeah?
So is that basically just like everything is relative to where your eyes are?
In the parietal cortex.
In the parietal.
Yes. Okay. Now, what we described in the first lecture was the idea of utility. That the idea that, you know, there are lots of stimuli around me. So when you're looking at in front of you, you know, you see me walking around, you see this giant screen, there's this green exit sign, all kinds of things on your fovea, right? But you tend to look at something that you would value the most. Hopefully, you know, something about your speaker that's talking to you. So that means that activity in the parietal cortex should represent not just what's on the fovea, but some notion of value that's associated with it. So let me show you an example of this. So in this case, what happens is that there is a cell in the parietal cortex that has a receptive field that's up here, this gray thing. That's the receptive field of the cell. When the animal is looking at this point, fixation, the receptive field of the cell is over here. Now right next to fixation, there's this little circle here, this black dot here. That circle tells the animal that when he's going to make a movement, he should be making a movement to this circle. And if he does so, he's going to get a reward for it. So the animal is going to make a saccade from here to the center, like you see there. And when he does that, the circle falls in the receptive field of this neuron. Now, the circle is important for the animal. Why? Because that's the goal of his movement. He's going to be making a movement to that circle, and when he does so, he's going to get reward, juice for it. So the value of that stimulus is high. And indeed, he makes a saccade to it, and he gets juice. Now, let's see what happens to this neuron when the animal performs a task. So when he's fixating here, this receptive field of the cell is here. There's nothing in this receptive field. The cell doesn't do anything. When he makes a saccade to the center, now this valuable stimulus falls on the receptive field. And you see that the activity of the cell increases. In fact, it does so even before the saccade is made. So in anticipation of this stimulus falling in the receptive field of the cell, the animal is responding. This is a valuable stimulus. And when the animal makes a saccade to it, its activity remains high. All right, now let's compare this to a condition where the same receptive field and the same circle fall on top of each other, but the circle now has no value to it because the animal cares about the plus sign. The plus sign is what's going to give the animal juice. So what one sees now is that the animal begins here, here's the fixation, the animal sees that, okay, the plus sign is what matters to me. So there's no activity in the cell because the receptive field has nothing in it. And now the animal makes a saccade to the center. So now the circle, just like before, falls on the receptive field of the cell. But now the cell doesn't care. Why? Because that stimulus has no value for it. And the animal makes a saccade to the plus sign. So the activity is there, not just because there's something in the receptive field. I mean, if you think about what's happening in your parietal cortex now, you have tons of activity that would be associated with stimuli on your fovea. But only one of them matters. Yeah?
The receptive field is always relative to the fixation point, right?
Yes.
So when the fixation point moves up, why doesn't it move up? And when it moves down, why doesn't it move down?
It definitely does. So it does move up. It would be up here. At the beginning of the saccade, at this point, the fixation is here, and the receptive field is still there. But after the saccade is made, the fixation would move up. The receptive field will shift with the fixation. Yeah, good point. Any other questions? Does it make sense? Value and content matter. It's not just that you have some stimulus on your fovea. Does it have matter? Does it have something that you value? Should you direct your attention to it? Would you be making a movement toward it? That's how you see activity in the parietal cortex. Okay, so the activity in the parietal cortex is a representation of what is it that I want to do. But it doesn't include data associated with the vigor of the movement, the effort that I'm about to make that movement. That effort information comes in the motor cortex and the premotor areas. Let's see an example of that in this experiment. So in this experiment, what's happening is that the animal is going to have to move a lever. And sometimes he moves the lever and he's going to have a load on it, so he's going to have to push hard. Sometimes he moves the lever and there's no load on it. So there's going to be an assist condition, there's going to be an opposing condition, and no load condition. So here's the lever, and there's this load that's attached to it. Sometimes the load is going to help the movement, sometimes it's going to resist the movement, and sometimes there won't be a load. So when the animal makes this movement, if you look at his muscles, well, when there is an opposing load, the muscle has to be active more than when there is an assisting load. Does that make sense? So the muscle has to push harder when there's an opposing load. Now, if one looks at the parietal cortex, what one sees is a representation of the target of the movement. Where are you moving toward? That place is out here, and that place is the same place regardless of if I'm moving with opposing a load or assisting a load. So you see a representation of where I'm moving toward. It has some value to me. If I get there, I'm going to get juice. But you don't see a representation of the effort. You see the effort representation in the muscle, and you see the effort representation to some extent in the primary motor cortex. So here, the cell cares about the forces that you have to produce. In the parietal cortex, the cell doesn't care. Questions? Okay. When us humans have a stroke in our parietal cortex, on the right parietal cortex, there's an interesting property that happens, and that's called neglect. Now, you can imagine that if there's a place in your brain that assigns value to the stimuli and makes it so that you direct your attention toward it, well, that would be a pretty important place, because if there was damage to it, then you would just simply stop paying attention to certain things when they are to the contralateral side of the visual field. Let me show you an example of that. So a stroke in the right parietal cortex, and in general perhaps also right frontal lobe, results in what's called left hemispatial neglect. So here's an example of how you would see it. You have a patient that would be given a figure like this, and you would ask the patient to copy it. And here's what they would do. They would copy the things on the right side and sort of stop and just not do anything on the left. You'd ask them, are you done? They would say, yeah, I'm done. Here's a house. You see that it's copied on the right side. A flower, that's copied on the right side. Another example of it is this. So you ask the patient, what is this figure? And they would tell you that it's a square. Then they would go and ask, you would ask the patient, okay, so count off all the dots that you see on the square, and they would just tick off the dots on the right. Similarly with the circle. What is this letter? It's the letter E. They can see it, they can identify it, but when you're asked to perform an action toward it, that action is directed only on the right side of the figure. So this is despite the fact that they can move their eyes. So they're not blind, they can see, but they don't direct actions toward things that are on the left side of their visual field. An example of this in their daily life would be they would not dress the left part of their body. If they have to put makeup on their face, they would put makeup on the right side of the face, or comb only the right side of their hair, and so forth. Yeah?
So when they pick off the dots, do they see and register that they're only doing a certain amount, but they can't bring themselves to do the rest?
So it's a difficult question to answer, right? All you have is what they actually do. And what they actually do is tick off the dots on the right side. It is not because they're blind, because I can tell you it's a letter E. And as you can see, they could move their eyes over here, and in which case, if they did that, then all of this would be on the right side of their visual field. But for them to move their eyes over there, they have to assign value to something out here. And there is nothing over there. So they don't normally move their eyes over there.
And if they're asked, after they pick the dots off, if they see it as all the dots are...
Yeah, they say they're done. Yeah. Yeah.
Why is it in the case of the drawing that they're able to completely draw the whole circle, or like the left half of the root?
Yeah, it's a good question. Maybe because this is one action for them, so they see the circle and they draw it. It's an interesting question. Why is it that these individual letters are not drawn as only the right part of the figure 5, for example? Why is the whole letter drawn? Yeah, I don't have a clear answer for that. Okay, so this is called neglect. It's associated with humans. It's very difficult to replicate this in other primates. It seems to be associated with the damage only to the right hemisphere. Probably because something to do with the lateralization of language in us. When damage is to the left hemisphere, you get a different kind of problem, and that problem has to do with loss of ability to speak and loss of ability to understand language, but you don't see neglect like what I've shown you here. So neglect is a right hemisphere effect in humans. All right, so let me summarize. Actions are planned in fixation-centered coordinates in posterior parietal cortex. Neurons combine proprioceptive information with visual information using a gain field. Movements are planned in terms of goals, not in terms of detailed forces. Lesion of the right parietal cortex can result in neglect. Okay. So the next topic that I want to show you is now moving forward in the cortex, moving now to the rostral part of the central sulcus. We get to the premotor cortex and the motor cortex. So what is happening in the motor cortex and premotor cortex? In the parietal cortex, we have representation of the action with respect to fixation. Where am I supposed to go with respect to where I'm looking? When you get now to the premotor cortex, you see a representation with respect to the effector, the hand. So if your hand is supposed to move someplace, then you see a representation of the stimulus with respect to your hand. Let me show you an example of that. So here's an animal sitting down, and a stimulus is brought toward them. And that stimulus is brought toward them when it's over to the left or to the right, and the hand can be to the right or to the left. And the idea is to show you that when the animal is sitting still and the stimulus is brought toward them, there is this location with respect to their hand that you see activity, in this case the premotor cortex, that would encode that. So for example, when the stimulus is here and the hand is here, the cell fires. So let me show you what this plot means. So 1, 2, 3, and 4 refer to the position of the stimulus in these 4 locations, 1, 2, 3, and 4. And there are these 3 fixation locations. The animal could be looking here, here, or here. And what you see is that in the first row, the animal is fixating A. It's looking here, and the stimulus is brought here, 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 and here. And only when the stimulus is brought here with respect to their hand does the cell fire. So the cell likes to have the stimulus to the right and close to the hand. Now, when the animal changes its fixation from A to B to C, nothing really changes here. So you see that the stimulus location is not with respect to where the animal is looking, but with respect to where the hand is. So if the hand is here, and the stimulus is here, the cell fires. Now when the stimulus, when the hand shifts to this side, as the hand moves to over here, the hand moved over here, now the activity shifts over to trajectory number 2. Sorry, trajectory number 3. So it seems to be coding where's the stimulus with respect to the hand, and when the hand moves, as you see here, the location where this cell fires, the receptive field, if you will, for the cell shifts as the hand is moving. It appears to encode stimulus location with respect to the hand and not with respect to the eye. Questions? Okay. Now what I want to show you is the difference between premotor cortex. Premotor cortex says, where is the stimulus with respect to my hand? And motor cortex. Motor cortex says, how do I actually activate the muscles to move there? Yeah?
Sorry, can you go back one?
Sure.
Why is it that stimulus 3 fires when the arm moves to the left, but it doesn't fire at stimulus 2? Because it seems like the hand is passing both stimulus.
Yeah. So yeah, you're absolutely right. So it could have been 2 or 3, but in this case, it's 3 that gives the largest activity.
But why not 2?
Yeah, I don't know. I don't know the answer. Thank you for that. Good question. Okay. What I want to show you now is that the premotor cortex has a representation of the stimulus with respect to the hand, but the motor cortex has a representation that says what are the muscles that need to be activated in order to make that movement. And to demonstrate that to you, I want to show you an example of a task where it's somehow similar to moving a mouse. In this case, it's a joystick, and the monkey is holding a joystick, and he's moving the joystick like this with his wrist. And by doing so, he moves a cursor on the screen. So here's the way he's holding the joystick, and as he moves the wrist up and down and flexes it and extends it, you get this motion of the cursor on the screen. Now, you could hold the joystick like this, or you can have the monkey hold it like this, as you see here, or move the arm around and do it like this. So if you think about it, in order to move the cursor upward and the hand is in this configuration, he would have to flex his wrist. So we have to flex the wrist to get the cursor to move up. But when the hand is in this configuration, in order to get the cursor to move up, he has to extend the wrist. He has to move the wrist this way, which is to extend it. Here, to move the wrist this way, it would be to flex it. So very different muscles would have to be activated in these two conditions. Does that make sense? All right. Does the premotor cortex care that you have these two very different muscles that have to be activated in order for you to move the cursor upward? Or does it what it really cares about is the fact that it's an upward movement of the cursor? So an upward movement of the cursor in all of these conditions is the same, but it requires different activity in the muscles. So to look at the activity of the muscles, what one does is that record their activity when, to record the activity of the premotor neurons, what one does is that record that activity when the animal makes this movement, and so forth, and then you tell the animal, okay, shift the way you hold the bar, and you record the activity in that cell again and again. And what this shows you is the results from one of those cells. So here's when the movement begins. Here's the pre-movement period. This is 1 second before the movement, 400 milliseconds after the movement. And on the y-axis is the direction of the movement of the cursor. So at 0 degrees, it's a movement to the right. At 90 degrees, down here, is a movement upward, and so forth. And this color here tells you activity in the cell. So this cell is active a lot when the cursor is moving to the right. And what you notice is that that movement always produces the greatest activity. It's always towards 0 degrees, regardless of whether the arm is in this configuration, or that configuration. So in all three configurations, that cell is firing for a movement of the cursor to the right, not the muscles that need to be activated. So this is encoding the motion that needs to take place with respect to this extrinsic space, this external space, motion of the cursor, not the muscles that need to move the arm. I want to compare that now to the primary motor cortex. So this is the same action as before. The animal is moving the cursor in these three configurations. But now what you see is that in the primary motor cortex, a cell that has its preference for a movement like this, if you now ask the animal to rotate his arm, its preference of the cell also rotates. The preference of the cell continues to rotate. So this is what you would expect if the cells care about the muscles. Because the muscles that would be involved in moving the hand so that the cursor moves up are very different in this condition than this condition. And so the preference should shift as the muscles that need to be activated change. And in the motor cortex, you see that. So in the primary motor cortex, you see an encoding that looks closer to the activity of the muscles. In the premotor cortex, it looks like where is the target with respect to my hand, this extrinsic space. Questions? Okay. So if that's true, then by putting loads on the arm, you should be able to see that the activity in the motor cortex gets modulated. So if the motor cortex cares about activity in the muscles, then as greater torque is placed on the joints, you should see greater activity in the neurons. So in this experiment, what's happening is that the monkey is placed in what's called an exoskeleton, basically a little lever here that produces torques on the arm, and the monkey is asked to maintain their posture, so push back against the torque. The torque can be an elbow torque, which is shown in this axis. Here's 0 elbow torque, positive torque, negative torque, or shoulder torque, which is shown on the x-axis. And you see two neurons. One neuron increases its activity when there's a shoulder torque. You see as the shoulder torque increases, this neuron increases activity, it fires more and more. And here's a neuron that increases activity when there is an elbow flexion torque plus a shoulder extension torque. So it increases activity for this torque. And you see this kind of representation in the primary motor cortex. So neural activity seems to be modulated by the force that the animal has to produce, closer to the muscles. All right. And indeed, if one looks at this series of activity that takes place when you make a movement, the activity in the premotor cortex comes on first. Where am I supposed to move with respect to the target? Then the motor cortex, which muscles should be activated, then activity in the muscles, the EMG, and then finally the finger moves. So on the x-axis is time. Here's when the finger starts moving, and the y-axis is normalized activity. Okay. Any questions so far? All right. So the last topic that I want to show you are associated with maps in our brain and the motor maps that make up our motor cortex. So we have a representation of our body in the motor cortex, and that representation was discovered through stimulation. When somebody undergoes brain surgery, it is possible to place stimulators on the cortex, exposed part of the brain, and stimulate at various regions. And so because the brain doesn't have pain receptors, it doesn't hurt. And what happens is that you can ask the patient, how do you feel when this place is stimulated? How do you feel when this place is stimulated? Or you can watch to see what kind of movement is generated. And so this is a drawing from Penfield, which he was a surgeon that began some of these experimentations. And as he was stimulating, he recorded in his notebook what was the patient telling him when the stimulation was taking place. And he began to see roughly a map that was forming. And you can sort of see the kinds of responses that the patient was giving him. Basically, the lateral part of the cortex along the central sulcus, so here's the central sulcus here, here's the motor cortex, which is the frontal part of the central sulcus. You can see that there's some sensation in the hand, the closing of the fingers and so forth. Mouth opens, and then this is lateral. So here's the lateral part of the central sulcus. The medial part, it gives you more in the arms and so forth. So it seemed like the medial part was a map that controlled the leg and the shoulders and so forth. The lateral part controlled the fingers and the mouth and so forth. Roughly, there was this map of the body on the cortex. And this is confirmed when one does stimulation in monkeys like primates like monkeys. So here's the macaque monkey, and here's the motor cortex is here. This region here is being mapped. Every one of these dots is a location where an electrode is placed and stimulation is done, and then you look to see what part of the body shows a movement. And so this medial part is up here, the lateral part is down here, and what you see is that when the medial part is stimulated, you see knee, the hip, the ankle, the hip, the trunk. And then as you go more laterally, you see the elbow, the wrist, shoulder, and the fingers, and then finally the mouth, the chin, and so forth, the jaw down here. So roughly speaking, the legs, the hand, the face. If one was to then really make a cartoon of what the system looks like, it would look like this. You'd have the face, the trunk, and the feet up here medially, so right around the place where the cortex folds, and then as you go more laterally, you get the hands and the digits, and then finally the face and the lips and so forth. Now, I'm going to describe a little bit more than what you see on the figures here, because until about 5 years ago, we really didn't know much about the female anatomy and how the female anatomy was represented on the cortex. And this is an unfortunate thing because, as I will show you, amputation causes a change in these maps. And what is the amputation that affects many females? I'm sorry?
C-section.
No, that's not amputation. What's an amputation that affects many females? Mastectomy, yes, that's right, that's right. So you get the breast removed. Now, when the breast gets removed, as I will show you, when there's amputation, there are disorders associated with it, and there's plasticity that takes place in the cortex. So where is the breast region? Yeah, it's here. Probably much bigger in females than in males. But we just don't know. Okay, so why do I say amputation causes a change in these maps? Let me show you examples of it. Let's begin with an example from a rodent model. So what we have here is a rat, and the rat has also a motor cortex. Now you notice that the brain of a rat is smooth, so you don't have the central sulcus, but what you can do is define the motor area by stimulating it. Okay, thank you. So when you stimulate the motor cortex, just like in primates, what you can see is that some locations give you movement of the forelimb, some locations give you movement of the vibrissa, that's the whiskers of the rat, and then some locations give you movements of the eyelid. So this is a map of the motor cortex of a normal rat. Now what happened in this experiment is that they surgically cut the nerve that was going from the spinal cord to the whiskers of the animal, removing the motor axons that would innervate it, effectively paralyzing the whiskers of the animal. Now what was interesting was that about an hour after this surgery was done, they went back and once again stimulated the same regions in the cortex. So you would have thought that if you were to stimulate here in the vibrissa region, you shouldn't see anything now because there is no motor nerve that's going to the vibrissa. Well, that's true. However, what was surprising is that stimulation here now produced movements either in the forelimb or in the eyelids. So there was a change in the motor map within an hour after the peripheral nerve damage. How could that take place? Let me show you the mechanism. So here was the data. So here was before the lesion that was made in the nerve, and here is after. So how was it that these regions here, which used to stimulate and produce movement of the vibrissa, now got stimulated and produced movements of the eyelid or the forelimb? So let me show you how this happens. So in the motor cortex, you had neurons that went down to the spinal cord and then activated motor neurons that went to the vibrissa. So this is what these neurons here. But it turns out that you went and cut this nerve. So activity here can no longer cause movements in the vibrissa. But the animal's brain recognizes that there is this sudden inability to cause movements. The afferents bring back information saying that your stimulation isn't producing any movements in the vibrissa. It turns out that these neurons in the motor cortex not only send axons to the spinal cord, but they also send axons to inhibitory neurons in the motor cortex that inhibit the neighboring neuron. So normally when you stimulate the vibrissa, you also cause an inhibition of the neurons that are to your neighbor. Now, when this pathway has been cut, there's plasticity that takes place in the motor cortex, and that has to do with weakening of this inhibitory connection. So now, when you stimulate here, of course you don't get activity in the vibrissa, but that stimulation spreads to a neighboring neuron because this inhibition has been weakened, so you get activity in the forelimbs. So the plasticity that takes place in the cortex, in the motor cortex following peripheral nerve injury, is due to weakening of existing inhibitory lateral connections between these regions. When that inhibition becomes weakened, the stimulation gets spread. Yeah?
So this is paralysis and it's different than amputation because in amputation you also don't have afferents left over?
Good point. That's correct, yeah. So in this example, you see this change that occurs very quickly. I'll show you examples also in amputation that seem similar. Yeah, go ahead.
With amputations, when there's, say, they do it at Johns Hopkins where they transplant hands.
Right, right.
So when they give that back, is
Right.
it the same region of the brain that activates again, or is it another?
So there are experimental results on this. So there have been a couple of studies that have looked at fMRI correlates of activity in the patient before and after hand transplant. And what you see there is that the hand region in a patient that has had an amputation is such that, of course, there is no hand region, but what happens is that the neighboring region, the biceps and the elbow region, they become larger than normal. They take over the hand region. But when there is this reconnection, when there's a transplant, those regions go back toward their correct size. Now, if there is ability to move the hand, if the surgery is successful, then you presumably would get activity in a region that you didn't have before. Yeah?
So would this increase in, like, I guess, stimulation region, like, correspond to an increase in dexterity in those regions? Or, like, for eyelids, for example, would the rat become more dexterous with the eyelids?
This is a really good question. So what do you gain when you now have this ability to engage neighboring neurons? Do you get increased dexterity, or what's the cost of it? There's no experiment that provides data on that. Yeah, I will show you that when you learn to do things, a sport, precise behavior, you are changing your representations in your cortex. You're expanding the region where activity would be associated with that movement. But you only have finite number of neurons. So what's happening with the neighboring regions? Are you losing the ability to, if you learn to do the violin, do you learn, that learning, does it have a detriment on your ability to play soccer? I don't know. But you definitely increase the region associated with controlling your fingers in one hand and the elbow with the other hand when you learn to use the violin. Okay, so let me show you that in a couple of examples. So the first set of examples I want to show you is amputation in humans. And as you know, since the September 11th, with the number of wars that we've engaged in, the number of amputees has tremendously increased, and there are a great deal of research that's going on into understanding what happens when there's amputation and help these individuals recover. So I want to show you how one can understand the results of amputation in humans using non-invasive stimulation. So how do you know the size of a motor map in a human being? Well, one thing you can do is place stimulators on the head called transcranial magnetic stimulators. These are magnetic stimulators that produce a pulse of magnetic energy that then gets transmitted to the cortex, produces electrical activity. So what I'm showing you here is data from an individual that has a stump on the right side. So you see their left motor cortex, and their left arm is intact. So you see the activity in the right motor cortex. Now there are some circles and things here that I want to tell you about. So this individual's right arm above the wrist has been amputated. The motor cortex is stimulated via transcranial magnetic stimulation, and muscle activity is recorded in biceps and a finger muscle. The lip and the first and fifth digits are touched, and evoked potentials are also recorded from the brain. So when you touch the lip and you record from the brain the evoked potentials, you see activity that's here. And when you you see activity that's here, this white dot here. And then when you stimulate the cortex, you see that on the left side, at this region, you get biceps activity. And here you see the finger, the wrist activity. On the other side, when the arm is healthy and hasn't undergone amputation, you see the distance from the biceps region and the wrist region is much larger than the distance in the contralateral to the amputated side. It's as if you have this effect here has been that just to be clear, the right arm of this individual was amputated, so the left regions associated with biceps has grown to be much larger than the contralateral side. It's the neighboring region. So when the loss is here, these regions become larger than normal. They take over the size that was left. Now, oftentimes there are consequences of this. The people that undergo these surgical procedures, they may have certain pain associated with it that's called phantom pain. Phantom pain relates to the idea that despite the fact that the person may have lost, let's say, their arm, they have pain in the body part that no longer is present. And it's unclear why that pain is and how to deal with it. Often it just goes away with a few years after the amputation. Okay, before I go, let me ask if any questions. Yeah.
Sorry. How long does this change take place, or how long after their amputation does this change?
I think I've seen it documented as early as like a month afterwards. Okay. You see this dissociation between the sizes. In the animal model that I showed you, it was just an hour.
And does it affect I guess use of prosthetics or something like the ones that?
Does it affect it? What do you mean?
Like their ability to control the prosthetic. Like I'm assuming that if they get fitted with a prosthetic within that month, they have better control over it.
Yeah, so presumably the use of prosthetics would try to reverse some of these changes, I would guess. Yeah. Any other questions? Okay, the final topic that I want to show you is learning and what happens after stroke. So perhaps you know an individual that has suffered a stroke, and then what happens to them after they slowly begin to recover. I want to show you what happens in the brain when you have a stroke, in the motor cortex, and what happens when there is rehabilitation, which is pretty much the only thing that we have now to help individuals. So this is a primate model, this is a monkey, and I want to show you how changes in these maps take place. The take-home message from this is that when there is stroke, there's of course an inability to move that body part, and often what happens is that the animal, just like the human, becomes less willing to use that body part. And that lack of use by itself makes it so that the cortical maps continue to change and become worse. And so what appears to happen with rehabilitation is that you're forcing the individual to use the body part that would otherwise not be used, and that seems to combat the cortical changes that are going along with it. So let me show you how this comes about. So here's the cortex of a monkey, and so this is the region where the map is taking place. Here's the motor cortex, here's the front of the brain, here's the back of the brain. So here's the sensory side, the motor side is over here, primary motor cortex. So this red region is places where stimulation gives you movements of the finger. The green is the stimulation gives you wrist and the forearm. So the lesion is going to be placed here where the red is. What happens is that after the stroke takes place, so after the stroke is, of course, black means that there is no stimulation, doesn't give you any movement. Now what you notice, however, is that you've not only lost this region, but you've also have much lower amount of red than you had before. So you have a lot more green here than you had before. Before you had some red over here, you could control your digits with these neurons here. Almost all of them have been taken over by the wrist. So a stroke affected the fingers, and as a result, you not only lost the ability to control the fingers in this region, but you also have an expansion of the forearm region. The green got bigger. All right. What does rehabilitation do? So the lesion is going to destroy 22% of the digit region, and then what this monkey is going to undergo is rehabilitation. And what does this mean? So in order to rehabilitate the animal, what was done is that, say that the stimulation is affecting the, say, I'm not sure if it was the left arm or the right arm. Let's call it the left arm. Say that it's my right motor cortex that has had a stroke, affecting my ability to control my left fingers. Now, if you just let me be by myself, what I will do is that I will stop using my left fingers because they're weak and it's hard to use them. I will just focus on my right hand. I will just use everything with my right hand. And that is possibly why you see this loss that you see here. So to rehabilitate the animal, what is done is that they put the good hand, the hand that is perfectly fine, in a glove, so the animal can't use it, so he's forced to use the left hand. And then what one sees is that, well, you lost the ability here. This is where the stroke was. But now that red region has expanded. It's taken over the parts that used to be blue. So perhaps rehabilitation works by making the system so that it uses the body part that would otherwise not be used. So this was translated into clinical trials in humans, and it's called constraint-induced therapy. And it's so simple. Basically, what one does is that after a person has a stroke, say it's affecting my right arm, now I want to use my, sorry, it's affecting my left arm, so now I want to use my right arm. What they do is that the patients come to the clinic and you put their good arm in a cast, so they can't use it. And they're forced to use the other side. And here's some examples of what those results produce. So this is a motor score, how well they can use the arm that's been affected. And you see that, well, right before the trial begins, they're pretty bad. And in almost every case, the performance improves. Afterwards, when the trials are over, they continue to use it, and there's little degradation even 6 months later. So lack of use is not just bad, it makes it so that whatever effect that had taken place because of the stroke gets worse. Use is critical in maintaining the plasticity in the cortex. Any questions about this? Yeah?
So going back to the slide before, so the blue part is significantly smaller, so would it affect the blue parts as well, like decrease activity in other parts of the body?
So this is a beautiful question. The balance has been shifted, right? So you now have more red in regions where it used to be blue. How did it affect the ability to control the shoulder and elbow? We don't know. If there is any effect on it, it hasn't been measured. So this comes back to the question of when you focus your activity on one body part, you will enhance the representation of that body part. Are you losing on some other body part? Is there a net sum that has to be 0, or is it that are you somehow increasing the number of neurons that you have? How does that balance work out? We don't know. So we know that neurons are born every day in your brain. So you have new neurons that are born every day, and a fraction of those neurons will survive and will add to what you have. What dictates which fraction survives seems to have something to do with the use. So if you actually use the neurons that are born in some action, then it's likely for it to actually stay around with you. So maybe there's some change in the total number of neurons that we have, but we don't know. Okay, the final point that I want to show you. This has to do with learning. So, we can't make monkeys to play violin, but what we can do is have them learn to perform difficult tasks. So how do you do that? So suppose you have the animal that has to pick up pieces of food, and you can pick up the piece of food out of a large well. This is really easy. Or out of a small well. That's hard. You have to go down and pick it up precisely with the fingers. And we know it's hard because when the animal picks up the food out of a small well, he is pretty bad at the beginning, but he gets better. The efficiency gets better over days of training. Now, if one maps the cortex as the animal is learning, what one sees is that with large well training, when the animal is excellent to begin with, the map doesn't change very much. But with the small well training, when the animal is learning to become excellent in picking up the food out of a small well, what you see is that the digit region, this yellow region, gets bigger. You get more representations in the region where the activity was enhanced. All right, my last slide. So let me summarize our story. In the parietal cortex, you have a representation of proprioception of the arm with vision of the hand. Stimuli are represented in fixation-centered coordinates, and you have these gain fields where position in proprioception is combined with position in vision. In the premotor cortex, you have a representation of the stimulus with respect to your hand, and in the primary motor cortex, you have this transformation from a desired movement to muscle activity and the activity of those patterns. So before you go, if I had one direction that I would suggest those of you who are interested in terms of research and future where we know almost nothing about, is what I was mentioning to you with regard to female anatomy, the effects of amputation in females on that anatomy, and here's a body of line of work that is just completely unknown. Thank you so much for your time.